there, you're welcome to DamiRx Care channel, where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below in order to help support our community here at DamiRx Care, and also in order to get alerts anytime we post our other educating videos and content here on our YouTube channel. All right, so what is our medication of choice today? Our medication of choice today is called Pantoprazole. So Pantoprazole is also known as Protonix, and this medication is used in patients who have heartburn. It can be used in patients who have ulcer, as well as Gerd or stomach bleeding, and it can also be used in patients who have an inflammation or swelling in their throat, which is also known as their esophagus. All right, so this medication comes in a 40 milligram tablet as well as a 20 milligram tablet, and it can be it comes in an oral tablet, it comes in an injection, as well as a suspension. And usually the common dose is about 40 milligram once a day. Patients may take up to 80 milligram, most especially if they have some stomach bleeding going on. And usually the maximum dose we try to keep it is 80 milligram. So what are some side effects of this medication? So some side effect of the medication includes stomach pain. It can cause diarrhea. It can cause nausea. It can cause gas as well. It can cause headache as well as dizziness in patients taking it. Like I said, this or common side effect that can happen. It's not all inclusive. So sometimes the patients may get this side effect, sometimes they don't. It really just depends on how well your body tolerates the medication. So what are some serious side effects to look out for while you're taking Protonix? So if you start getting any pain in your right abdominal, upper abdominal area, this medication may cause pancreatitis, so you want to make sure you're getting that checked out. Also, this medication can cause low B12, so which can be a form of anemia in patients. It can cause, if you start feeling any symptoms of an allergic reaction, like your throat closing up, while you're taking the medication, like you're having shortness of breath, make sure that you're seeking emergency help immediately while you're taking this medication. So what are a couple of things that you want to know while you're taking this medication in order to be able to take it effectively? So this medication, unlike other medication in its class, such as omeprazole, lansoprazole, so this medication, pantoprazole, can actually be taken with or without food. So usually with the other medications, you want to take it 30 minutes before you eat. But however, with pantoprazole, it's much different, as you can take it with or without food. However, in patients that are taking the oral suspension, you want to make sure that you're taking it 30 minutes before you eat. However, if you're just taking it as a regular tablet, you don't have to take it 30 minutes before you eat. You can take it with food or without food, as I said earlier. So as I said earlier, this medication can reduce B12. And the way this medication works is it reduces the amount of acid that the stomach is producing and kind of alters the stomach function a little bit in terms of B12. So by altering that production of B12, this can lead to a form of anemia, and we want to make sure that patients are getting B12 from another source, maybe taking a B12 tablet. If we start noticing from the patient's blood work that the patient has, some sort of B12 deficiency or low B12 going on. That is a common reason why we don't really expect you to be taking this medication for a longer period of time. That way you don't get, like a chronic anemia, because, your body, it is not producing as much B12 as it should. Also, this medication can cause low magnesium. So this is something to look out for while you're on this medication. You just don't want to take magnesium except, if it's something that's prescribed to you, maybe your doctor recommended it. So that's when you want to start taking the magnesium supplements. But if not, you probably don't need to take the magnesium supplement, except you were advised to by your doctor due to lower levels from your blood work or your labs. All right, so this medication can increase risk for osteoporosis. So this medication like I said, shouldn't be taken for long term. Usually in patients who have osteoporosis, there's risk for fractures, bone fractures in those patients. So that's why we don't want you taking this medication for a long-term period, as like I said, it alters the stomach function, and that can kind of prevent it from prevent the stomach from making those regular substances that your stomach would regularly make in order to help support the body. So this medication usually comes in an extended release tablet, so you don't want to crush, cut, break or chew the tablet. You want to make sure that you're swallowing the tablet as a whole. If you're taking the capsule, you can open the capsule up and empty it into a tablespoon of applesauce, but just make sure that you're taking that applesauce immediately with a cup of water. That way, it kind of helps with the function of the medication and helps it work effectively. These are stuff to remember while you're on this medication. I hope I was able to help you in terms of what to look out for while you're on the medication. For more information, you can check out our website at www.damiarxcare.com to consult with a pharmacist regarding this medication. Thank you for watching and stay blessed.